Hi everyone, I'm honored to lead our talk today regarding scoliosis, its types, causes, examination tests, and treatment. Scoliosis is a condition characterized by an abnormal lateral, sideways curvature of the spine. It is typically diagnosed when the curvature measures greater than 10 degrees on an X-ray. The condition is categorized based on its cause and the age at which it develops. Number 1. Idiopathic scoliosis. This is the most common form, accounting for approximately 80% of all cases. Idiopathic means the exact cause is unknown, though genetics often play a role. It is divided into subcategories by age: infantile, onset from birth to age 3; juvenile, onset between ages 4 and 10; adolescent, AIS, onset from age 11 through the end of growth. This is the most frequently diagnosed type. Number 2. Congenital scoliosis. This type occurs during fetal development. It happens when the vertebrae do not form correctly or fail to separate as the baby grows in the womb. Because it is present at birth, it is often detected much earlier than idiopathic versions. Number 3. Neuromuscular scoliosis. This is caused by underlying medical conditions that affect the nerves and muscles supporting the spine. When these muscles are weak or unbalanced, the spine can lose its alignment. Common associated conditions include cerebral palsy, muscular dystrophy, spina bifida. Number 4. Degenerative scoliosis. Also known as adult-onset scoliosis, this type occurs later in life. It is caused by the wear and tear of the spinal discs and joints, spondylosis. As the structures of the spine weaken with age, the spine may begin to shift to one side. Number 5. Syndromic scoliosis. This type develops as part of a larger systemic syndrome. It is often a secondary symptom of conditions that affect connective tissue or bone growth, such as Marfan syndrome, Ehlers-Danlos syndrome, neurofibromatosis. Beyond the specific causes, doctors also distinguish between the nature of the curve: non-structural, functional. The spine is physically normal, but a curve appears due to a temporary problem elsewhere, such as one leg being longer than the other or muscle spasms. The curve usually disappears when the underlying issue is fixed. Structural. The curve is fixed and does not disappear with changes in posture. This involves a permanent change in the rotation and shape of the vertebrae. While the previous categories focused on why the curve happened, the cause, terms like thoracic and lumbar describe where the curve is located on the spine. There are 4 types of curves: thoracic scoliosis, lumbar scoliosis, thoracolumbar scoliosis, combined double major scoliosis. Treatment. Treatment for scoliosis is rarely one-size-fits-all. It depends heavily on the severity of the curve, measured in degrees, the patient's age, and how much growing they have left to do. Here are the standard treatments applied to the 4 anatomical types. Between 10 degrees to 25 degrees, observation and physical therapy; 25 degrees to 40 degrees, bracing, if still growing; 45 degrees plus, evaluation for surgical options. Examination tests. There are several tests for examination of scoliosis: plumb line drop test, physical examination; Adams test, position, special test; Cobb angle, radiological; flexibility test, radiological. That concludes my presentation. Thank you for your time, and I'll be here if you'd like to discuss further.